Inside Edition, weeknights at 7:30, right here on Local 3. Before you know it, this cold winter weather is going to be gone and shorts weather is going to be here. Very nice to have Dr. James Goodin on the show with us today. He's with Milligan Vein, talking a little bit about those varicose veins and spider veins and ways that you can help. So good to see you.
Hey, thanks for having me.
I know I'm kind of jumping in on the cosmetic side because that's easy.
Sure.
The truth is you do see people for that reason, but often it's for really health issues because when you have a vein problem, it can be very painful.
Sure, and really the vast majority of patients that I see are seeing me for medical reasons. They're having pain, discomfort, heaviness in their legs, cramps, restlessness, and then we see some of the extremes of vein disease as well. We see folks who have chronic wounds and that sort of thing.
Let's get into as much of that actually as we can this morning, but first I want to ask you this. I would think if someone's coming to you and they hurt, they want to not hurt, and probably they think, oh good, I'm going to go see him and he'll fix me right away. It is a process though, isn't it?
It is a process, and some of that is dictated by just the insurance industry, and some of it is good medicine. So folks come to see me, and again, that's the chief complaint that I get is my legs are bothering me in one form or another. And if you think about it, there are a lot of things that can cause people to have leg pain. And so part of my job is to kind of sift through all the information and details and try and give patients a reasonable expectation about what treating their vein disease where that will leave them.
Right. So you want to also make sure that you're understanding the root cause of something, and you can't always know of really until you've tried the methodical approach. Right,
and there is a mandatory non-operative treatment phase that we have to go through with our patients, and like I said, that's mandated by the insurance industry.
Sure.
And it's very simple. What it entails is wearing some prescription strength compression hose, elevating your legs, and taking an anti-inflammatory medicine. We have to do that for 90 days before we can attempt to do any kind of surgical treatments, which do give you more of a sort of a permanent relief. But there's some good things about the non-operative phase. One, it's not just jumping through sort of hoops, but it gives us like I said, there are multiple reasons for people to have discomfort in their legs, and by going through I watched your clinical response to the non-operative therapy, and if you have a good response, some improvement in the swelling or the tiredness in your legs, or maybe they feel less heavy or what have you, by using the compression hose and doing the other things that I talked about, then that really gives us a good feeling or it gives us a good idea of what fraction of the discomfort you're describing to me is actually from the vein disease.
Is that pain going to occur in the lower leg? Just because of blood flow reasons?
I mean, it can affect the whole leg, but typically the majority of folks do have their symptoms tend to be more pronounced from the knee down.
Does age play a factor, or is it more lifestyle that plays a factor?
Age definitely plays a factor in it. Really the biggest risk factor in my opinion is genetics, and so folks who get vein disease, just to put it simply, have stretchier veins than people who don't get vein disease. And yes, a life of stress and just walking and being in our feet, and that sort of gravitational pressure on the legs over time does sort of help stretch them out, so to speak.
For women, if you've had 2 children versus 5 children, are you more prone to develop it?
I mean, pregnancy is a risk factor, or just women are more likely to get vein disease than men, and it's not just as simple as the pregnancy. I mean, certainly there's the mechanical issue of having a gravid uterus sitting on the venous outflow out of the legs, and that can kind of cause a bottleneck and exacerbate the symptoms. But also there are hormonal differences that women have as opposed to men that affect sort of the elasticity and the compliance of the veins as well. So
you mentioned the wound. So it's one thing, I guess, to look down and see veins that are shifting in their appearance, but a wound, what's that going to look like?
So oftentimes we'll see these sort of what we call inflammatory skin changes, and it'll a lot of times look like just a darker hue of the skin around the ankles and shins. And it kind of starts off sort of insidiously, and over time it gets darker and the skin quality changes. And when it gets in its more extreme cases, we'll see wounds that'll occur spontaneously, or just if you scratch your ankle shaving, or just bump into something and you get a wound, it can take forever to heal sometimes, and that's a consequence of there being just this sort of chronic inflammatory process going on in the legs.
So if that's happening to you, is that where like compression socks are going to come into play, or would you be more of a candidate for the surgical intervention?
Well, I think both play a role.
Okay.
And like I said, we have to start everybody's process
Sure.
out with compression hose. I do find that most of my patients aren't satisfied with compression therapy as just an end point of their treatment journey. But it definitely, the compression stockings have their place in the treatment
They
as
help.
well.
So what you really find is that all of this is hyper-personalized to you.
Absolutely.
But there are just the protocols they have to go through. But in the course of those 90 days, you're learning, they're learning, and you're working your way towards the end result that everybody wants. Is that fair to say?
That's very, yep.
Okay, here's where you will find him. Dr. James Goodin at Milligan Vein in Cleveland. 961-5682 is the phone number, and if you want to look him up online, it's pretty simple, milliganvein.com.
At-home medical tests. They're convenient and cost less than a doctor's visit, but can you trust the results? Which ones could be a waste of your money? We get answers to help you stay well and make ends meet. Monday